Champlain Castine at North Country Medical Center. We are in the back of the parking lot off Route 11 and facing toward Route 11. We are awaiting a noon announcement of what we think will be exciting news. The Hudson Headwaters Health Network will very shortly be operating the North Country Medical Center, and it is our understanding that they have leased this site for at least 3 years and will probably be looking to build and expand if everything goes according to plan. So we're going to find out exactly what those plans are, what the official announcement will say, and if everything isn't covered, we'll try to fill in the blanks after the official press announcement here, which will be coming at noon, August 13th, 2012. Okay, I was expecting a noon start, but I've been told that it's been pushed back to 12:30. It might be a little bit later because we're awaiting someone. But one of the most important people is here already.
Our Commissioner of Health will be here in just a few minutes, but everybody's, I think, enjoying themselves and getting started.
Yes, everybody's enjoying each other's company. Dr. Howard Ruggie?
No, Don Ruggie.
Don Ruggie, I'm sorry. I'm just talking to Howard Nelson and I got Howard on the brain there. Okay. Medical doctor and CEO of the Hudson Headwaters Health Network. What does all that mean?
Well, I'm a family doctor. I came to a little town, Chestertown, a long time ago when that area was losing its physicians. And we had a lot of help and a lot of corridors, including Washington and Albany. We've been able to build one health center after another. Dr. Racine reached out about a year and a half ago and looking at leaving a legacy for this area by way of a firmly established healthcare center that will do primary care with a number of physicians, mid-levels, nurses. And we talked after no one other applied to the federal government's support, have won that support, and now looking for state support. And in fact, the commissioner's coming with a great sign. We expect good things for Champlain and Moores and the whole area.
Exit 25, is it?
Our exit?
Yes.
Oh, we go by, we started exit 17.
Exit 17?
Yeah, we go way down.
Okay. It's Chestertown?
Chestertown is exit 25.
That's right. That's right. I pulled off one day there with a motor problem.
Oh yeah, coming up the north way. That's one way of getting to Chester. We have a breakdown.
Yeah. Outside of that, medical emergency. So, are you still operating in Chestertown? Or okay.
I see patients in Chestertown and the next town down, Warrensburg. We have now 126 providers covering the 14 centers. And, October 1 we expect to be with Dr. Racine operating here in 2020.
Okay. Now,
operating as a general term.
Yeah, right. No.
Not necessarily on the table.
Right. Not with scalpel. Right. Operating with a scalpel.
Yeah, we'll handle the cuts. We're not going to take your appendix out.
Okay. So, what could people walking in here initially expect? See anything different?
Well, initially it'll look much the same. Dr. Racine is staying. We hope the entire staff stays. We're beginning to recruit now, so we've got two big projects going. We're recruiting for additional physicians, and we're looking for property so that we can build a new health facility.
I noticed one of the things that scared me here in the back was that in most of our Adirondack health services, the local town provides facility, utilities, and upkeep. That won't be the
that will be the case here. We've got outside support. When we first started, we had no outside governmental support, and the only way this got started were the towns provided with facilities, which they still do. That's now a matching requirement to receive their federal dollars. Thanks to that investment by those local towns, we now can afford to be here in Champlain.
Okay. Now, you're saying in Champlain, but this medical center serves a lot more than just this town, right?
When we say North Country, we mean really north. It'll be Rouse's Point, Champlain, Jay-Z, Moores. We pride ourselves on taking all patients, regardless of insurance or no insurance, all ages, from newborns to as old as can be. And it's a formula that works for us everywhere else, and we're sure it's going to work here.
Okay, so the people with insurance will be welcome, but I do see that you are here to serve the people without.
Yeah, our first focus on people who can't go anywhere else. They have no coverage, no insurance, we have to fight in fees. We will reach out and help anybody who needs care that's having trouble getting it.
Okay. So what exactly, do you have a vision? Do you have something on a computer with a future building planned, or is that something that will be worked out in the coming years?
We have a building in Queensbury that opened in January that is just about the right size, and so there's a starting point. Take that plan and then adapt it to the special needs we may have here. We think, for example, there should be more mental and behavioral health care here because this is going to be the only spot where it's transferred for health care. We'll have blood drawing, we'll have, again, caregivers for people of all ages. It'll be full service.
Okay, now 6 days a week, 7? Obviously not 7, but
I would
6
say
days a week.
6 days a week. We're going to look very soon at expanding into evenings and certainly expanding into Saturdays. Yes.
Our walk-ins, you have to have an appointment?
We ask our people whenever they can to call ahead so we can work them into the schedule. But if somebody comes in, we don't turn anybody away for any reason.
So, all of a sudden you cut yourself.
You come on in and we'll take care of it.
Plattsburgh's 20 miles away, or this place
That's what we're here
right
for.
here?
That's what we're here
So
for.
we'll be right here to help out.
Absolutely.
Okay.
If somebody needs a house call, we'll do that too.
What?
Yeah, exactly.
Let's make sure I heard that. You said house call.
Sure. Absolutely.
So obviously
Now,
you're doing that. You're not.
We're doing that as a recommendation. We have 400 people who can't leave home and would have to be in a nursing home or a hospital because that's the only way to get medical care except we're in the home. So far we've got 400 people who are absolutely dependent upon that level of care.
Now, what are they for the number of communities you're in? I think you may have mentioned that. How many?
Yeah, we have 14 centers.
14 centers. How far south?
South Glens Falls, further south. We don't expect to go any farther north than Champlain. We think we've reached the limit. We can see the lights of Canada, and so we know that's as far as we dare to go.
But you're not going to go east of here either, because that's in Vermont, and you're New York operation.
That's true. We're a New York operation. We're snuggled right up against the corner.
Well, I'm certainly glad for the people of here that
we've been
you heard about us.
Very appreciative. Larry's welcome, and the town board has been nothing but welcoming and friendly. Stevens Mundy of CBPH suggested we give this a whirl, and Dr. Racine has been so enthusiastic and such a good
Hi, how are you?
So far, everything's working, and even the TV reporters are friendly.
Well, some are. I'm not one of them.
I'm stereotyping now.
And I see Dr. Southwick here, John Southwick here.
I've got to meet Dr. Southwick.
Yeah, he's the old fellow there with the white hair.
Oh, that's good. Nice way of getting to know him.
Yeah.
But he wasn't sure. He's a big car buff, so they had the big car show in Stowe, so I think he wasn't planning on being here, but he must have come back to do it because of this. So he wasn't here at the very beginning, but shortly after the very beginning, he was here. He hasn't been gone that long, so I'm sure it means a lot to him to see this carry on.
That's right. This is a legacy for so many people. Voting lifetimes with their we expect this to go on.
That's good news. Doctors, recruiting doctors is not all that easy.
No, we know that. We've got, so far we have 106 providers, not counting Dr. Racine and his staff, and so we expect us to keep adding to that.
So you know what you're doing.
Thank you very much. Thanks a lot.
Thank you.
All right, Dr. John Rubin, and over that way, Dr. John Southwick has shown up, and we're glad that John is here to witness all this.
Sorry about the delay, but there's it's kind of a special event for this area, for their shortage of primary care. I want to introduce Dr. Salvik, and he's the one that started this, really, 50 years ago.
Wrong.
All right.
I did not start.
Now I got to do
I
it.
dropped it on the way, too. Now, this was started by the 3 villages, Board, Champlain, Ross, and Swan. You have a board, only one. That ages me. Only one member left. But the first doctor here was Richard Schulteis. He stayed a year, 62 to 63. And then I came over to 63. Unfortunately, George Starr came in 65, Morris in 81. And we also had Megan Hess for a little while too. It was plenty of room for 4 docs and probably 5, right? Plus just one nurse practitioner and PA. So we gravitated and grew from there back to Morris.
Well, at this point, the guy that really made it happen, we started about 3 years ago, was Dr. Runge and this whole organization. No one person really makes anything happen. It takes a team of people. And Dr. Runge, I think, knows everybody here, so he's up to bat.
I can't tell you what a warm welcome we've had from so many people, starting with Dr. Racine, all the community leaders who are represented so very nicely. We have a number of people who would like to say hello to this group, each one of whom himself or herself has made huge contributions in terms of moral, financial, literary, and other support in terms of bending the ear of our best friends in Albany and Washington. This has been a huge effort to try to build upon the legacy left by Dr. Southwick and Dr. Racine so that there is an assured source of primary medical care for this North Country area for a long, long time. And I think we're at the beginning of something new, building on something that's been, I wouldn't say old, but something very important that Maurice is staying against all odds, it seems, at some point. So we have a number of people, starting with Larry Balkin, who has been, as town supervisor, our initial point person to say, if we don't have town support, we don't have anything, because this depends on the community. We will be a community health center, and it starts with Larry.
On behalf of the town board, I wish to welcome Hudson Headwaters to the North Country. When I first heard about it a couple of years ago, we knew it was a much needed service for the community, not just Champlain, Russell's Point, but Moores, Alpena, Chazy, the whole North Country. Enhances people not having to go to Plattsburgh for a lot of services. So we certainly welcome the board. We welcome the commissioners today. Glad to have you here. We feel it's going to really enhance medical services for everybody. Much more than probably we have today in a few years from now. They intend to rebuild, I guess, a couple, 3 years from now. We hope to be part of that also. So again, thank you all for coming up, and thank you.
Larry is not the only elected official here. We are really, really pleased to have our state legislators and then some, Senator Teresa Sayward, who I got to know right after your election and came to visit one of our health centers at Hudson Headwaters, and I found I didn't have to do much explaining. She had been a board member at the Smith House in Roseboro for years, and I think time and again saved that center. All these operations are delicate. We take care of everybody. We are proud to take care of all the people who go anywhere for their care. The people who have nowhere else to go because they have no insurance, handicaps, and so for her to come across districts, all the way to the North Country means a lot.
Thank you, John. Well, I wanted to be here today because it's very exciting for a community to have the stability that I know Hudson Headwaters will provide here with their healthcare center. I've watched it happen in my district. Many of our small communities in the Adirondacks would have nothing if it were not for Hudson Headwaters. Not only do they have healthcare centers, but they have some of the finest care that you can get anywhere, and I know that will be provided here in Champlain. And I'm just happy to be here. You know, all you have to say is 2 words and things get done, and those 2 words are John Ruggie. Thank you.
We heard about the award from Washington that makes all this possible about a month ago. And the day after we heard the award, I happened to be hanging out in the Capitol, and Jan Dupre saw me, and she came up and gave me a hug. And I know I'm a very appealing character, but I don't think it was anything personal. I think it was her hug for the care and the benefit of so many people who live in this North Country region. Jan?
Thank you, John. Welcome to the North Country. We are just absolutely delighted to have Hudson Headwaters here with this facility and the care it's going to provide. Commissioner, thank you for being in the North Country. You know, you look that way, you can see Canada. We're delighted you're here and appreciate your support throughout this project. It could not have happened without you stepping forward and doing some things to create your magic, and know that we appreciate it and recognize your support. And you know, when I was a member of the CVPH board, I got to know Dr. Ruggie a little bit, but certainly through Teresa and their great relationship, I have come to know him very well. And yeah, that was fortuitous that day that I saw you in the Capitol, and I had just gotten the news that this had been approved. And it is a great day for the people who live here in this region, who live in the North Country. It provides that continuum of private practice and the initial quality care that the North Country folks deserve, they want. You know, we continue to say we have the same rights as everybody else across this state, and we need to have our community services provided in our communities. And certainly the connection with Hudson Headwaters and CVPH and with the new affiliations that are happening, this is just the beginning of great things to happen. And absolutely delighted to be here today. Congratulations on your success again, the magic touch. Thank you.
I didn't mention this is a vacation day for Jan. She's been late on vacation to be here. There's something about Larry, I think, and all the local officials and the people they have. Senator Betty Little also knows about healthcare. She knows about one of the facilities that we developed in Mariah, and the story that I heard that helped convince us of the need is she went to a facility in Mineville that at that point didn't have the kind of funding we're able to enjoy. And the critical point came when she had to go to the ladies' room, and the building being what it was locked in and couldn't get out. And so we have done nice things in Mariah. We can go in and out of the ladies' room and the men's room with no problem. And we look forward to her support as well as Jan's in terms of future funding, so we can have a similar kind of facility expansion here. But I can tell her that Dr. Racine's doors all work. People are glad to be here. Betty, thank you very much for being here.
Thank you, John. And thank you, Commissioner, for coming, because this really is a great event. And when we say that John Ruggie and Hudson Headwaters is now in the North Country, we mean it. You can't get any farther north. So. But I really want to congratulate Dr. Racine, too, on having the vision to look for something and to work to see that this would happen rather than waiting until you're in a crisis stage. And I think that's pretty much what was happening in Mariah and Mineville, and that is a true story. So I thought to myself, boy, this place needs a new building for one thing, but more than the restrooms is better health care. And that's what Hudson Headwaters provides in all of their clinics. We talked about Dr. Ruggie. It's been mentioned several times. And yes, he has a great team, but believe me, he is a great leader. He knows where the money is, and he knows how to get it. He knows the programs better than anyone else that I know of in the health field. He's the first one to bring the 340B program into our area, and it's now throughout the area, helping with pharmaceuticals and all. He knows his way around Albany, and he knows who to talk to. And I just admire him so much, and I'm really proud to be one of the ones who represents him and works on these things. But for this area, for Champlain, and for all the communities around us, you will now have a, as Janet mentioned, the stability of a health clinic that you know has the funding to be able to continue on a year-in and year-out basis. And we have some of the Hudson Headwaters board members here. I hope you get to meet them and talk to them, because they're great people, they listen, and they are always evolving into the newest and the needs of the community. They never stand still. They're always seeing that we grow and we continue to provide health care to those that need it. So this is wonderful, and I'm really excited about it, as all of you are. But thanks to everyone who worked on it. And Stevens Monday's here from CVPH. I think one of the other great things is what we're seeing is our healthcare facilities working together to provide good health care for all of us. So that's key, and I appreciate all of their efforts. So thank you, and again, thank you, John.
Senator Little mentioned Albany, but actually you're closer to Burlington. And we think that Fletcher Allen and all it's doing with CVPH is going to be, again, an amazing partner, both for the subspecialty, the tertiary care that people have nowhere else to go, and also for the teaching. We think that over time, throughout this North Country area, we need to bring in medical students and residents so they know that it's possible to practice in a little town and feel really, really good about it. Maybe not make much money, but feel really, really good. So we have Diana Scalise here, who is the Chief of Strategy for Fletcher Allen, and we are counting on Diana and all her confreres to include us in a strategy for Vermont.
Congratulations to all of you who worked so hard to make this happen. I think John was selling, because now I've really got to make this family residency thing happen. But Fletcher Allen is pleased to be one of the primary care proponents in the North Country, and we want to do whatever we can to continue to support the access to that. And we're hoping that family residency program, we can all pull that off here and support that, because that really will help to continue a pipeline of providers to this area. And it's such a beautiful area here with the lake and everything, all the services that are here. And we're looking forward to continuing to work with the folks at CVPH on our continued partnership. And we're just all really excited about that. We're finally all starting to work together in a cohesive fashion. And thank you all for the invitation today. Congratulations.
As I mentioned, it took a lot of people to make this happen, and it did. But there was one conversation that made it possible and made it happen, which I'll get to in a minute. But for how many years now? 5 years. There's been work at creating Adirondack-wide a medical home pilot program, a way of bringing new resources to the North Country, especially for primary care. So basically, we expect to transform the way we give care and account for ourselves. No longer about doing more and more, just for the sake of more and more, but looking at those strategies that work best to improve the health of people. Stevens Bundy was the indispensable leader for that medical home pilot. And when Dr. Racine first called me, I made a phone call, and that was to Stevens' office and to Stevens to say, I don't know Dr. Racine, I don't know Champlain, this is your territory. Should I return this call, Maurice? And he said, I'd say go for it. And we did. And so as much as we're doing here, it came out of the mind, the imagination, and the statesmanship that Stevens Bundy has brought to the entire North Country. Stevens.
Thanks very much, and truly appreciate those kind words. I guess the first time I met Mo Racine, other than at the hospital, some of you may know that he's an avid hockey player, or was. Well, he was also an avid racquetball player, And I was playing racquetball with him, and someone told me, he said, you know, watch out, he's a hockey player. I'm from the South. I didn't know what that meant. I didn't know that you could get checked into the wall playing racquetball. But we had a great many games before his hips, my knees gave out on us. But I think it's that kind of fighting ability that gave him the ability to drive this practice forward and to make it what it is. And I congratulate you as well on really setting this up for the future for your community. And just want to thank you for that. Congratulate John Ruggie, and just good day for your community. Thank you.
Hudson Headwaters Health Network is an FQHC, and probably most people here would have no idea what in the world is an FQHC, Federally Qualified Health Center. It's a special kind of care, and Hudson Headwaters is proud to be one. We've been a community health center since 1980, but thought we should import a real expert to define what this is. And the expert is the CEO of our state association. So important to know that along with the funding that we received, permanent federal funding, assuming we do a good job, permanent federal funding for a health center here, there were 27 other communities that benefited from the same program with an announcement last month. And Elizabeth Swain, as the chief of Chicanes, was busy with many, many of those communities developing the expertise and the ability to write those applications in a convincing fashion. And perhaps more than anybody else, Elizabeth Swain knows what an FQHC is.
Thank you, John. It's wonderful to be here. It's a very, it's sort of emotional time, I think, for all of us who have hoped, kept our fingers crossed, and done everything possible to make sure that many of these new program awards came to communities like this one. So far off the beaten path, so far from the parts of the state that normally get all the attention. So it's wonderful for that reason. And just in a couple of sentences, a federally qualified health center, an FQHC, is a community health center, a primary care practice that is governed by the community that it serves, an independent, freestanding 501c3, tax-exempt organization. It's able to contract with public and private entities to provide all of the important services to its community, but again, governed by the community, providing care to people regardless of their ability to pay. So that means regardless of whether they have an insurance program or not, on a sliding fee based on their income, and providing a full, comprehensive set of services. Now we call that the patient-centered medical home. The comprehensive one-stop shop for medical care, oral health services, mental health and substance abuse programs, and the entire set of support services that are part of that make it possible for people, really regardless of their ability to pay, to be healthy, to have much better than average results in terms of their health care. We like to talk about high quality care for people, population health for the community, at a very, very affordable price. So that's what a federally qualified health center is, an FQHC. I mean, you'll sometimes hear them referred to as community health centers. There are 1,200 of them across the United States, serving 25 million people. In the state of New York, there are over 60 of them, serving 1.5 million people at 500 service locations. So we're very happy that we were able to get 28 new access point applications for this state, and we look forward to continuing to be able to grow the primary care infrastructure here in the state. There are lots of communities that will continue to need that. So that's the FQHC component. I also want to I brought my glasses up so I could read this. I'm very honored today to be able to present a proclamation in honor of this event from the governor of the state of New York. This proclamation will become part of the history, the living history of this wonderful moment. I don't think I should read the whole thing. It probably would take would you? It is a bit. Well, I'll read a bit of it. So, the State of New York Executive Chamber Proclamation. Whereas community health centers are nonprofit, community-owned and operated healthcare providers, providing access to care for all New Yorkers regardless of their insurance status or their ability to pay. Whereas community health care centers offer comprehensive primary and preventive health care services to over 1.4 million New Yorkers, nearly 90% of whom live at or below 200% of the federal poverty level. Whereas community health centers are critical to the health and well-being of the residents of New York State's urban, suburban, and rural communities. And their models for delivering primary and preventive care have been recognized as one of the most successful at improving health outcomes and reducing health care costs. Now, therefore, I, Andrew M. Cuomo, Governor of the State of New York, do hereby proclaim August 5th through 13th, 2012, as Health Center Week in the Empire State, and urge citizens to recognize the important contributions of community health centers in safeguarding health and improving the quality of life for all people throughout the state of New York. Signed by the governor. Congratulations to the Champlain Health Center. Congratulations, Bill.
Commissioner, members of the legislature, ladies and gentlemen. It gives me great pleasure to be here this morning. I'm a former member of the board of Hudson Headwaters. Being a federal board, I had to get off because I had my elected time. I have to be off for a year before I can think about going back on again. But I'm still a member of several committees, but I just want to say that I'm glad to be here. Congratulate John. I want to congratulate people from Fletcher Allen because John has given me the job of looking into the cooperation between health centers and the institutions like Fletcher Allen and the University of Vermont. So we all know that there is a shortage of primary care physicians. In fact, the statistic is that only 2.5% of the medical students that are going to be graduating are going into primary care. What does that mean? That means pretty soon we probably will not have primary care physicians unless we change something. Okay, and one of the things we like to change is try and get students and residents to come to facilities so that they can see what primary care is really like. Many of them really would like to go into primary care, but because of the debt that they have incurred over their medical school are unable to do that. So hopefully we'll be able to change all of that in the future so that there can be loan forgiveness or some of the programs that we can initiate so that we can have more quality physicians or primary care physicians to take care of the people not only in the North Country but also throughout the United States. I want to thank everybody. Commissioner, thank you for coming, and to John for his program, and I'll turn it back to you.
The safety staff, our Hudson Headwaters staff are here, and I think one of the scariest things is it's a corporation. We're a not-for-profit corporation. Bill Dwyer is the face of that. Sharon Callahan, our current chair, is also here. So we are owned by a board of directors who work for free, who travel for our monthly meetings, have committee meetings all the time, are our eyes and ears, and work so hard to make sure that we have health care in these little towns that otherwise would go without. At the most recent board meeting, a couple of weeks ago, our board appointed Celine Paquette from this area as our representative, Champlain's representative, the North Country's representative, the real North Country, to Hudson Headwaters. So she'll be attending our upcoming meeting in September. And if you take the cruise through Dr. Racine's office, you'll see the video conferencing equipment we have now. So it won't be necessary to take a 4-hour trip every single meeting. One more example of how many people it takes to pull together a health center. One of them is here. In fact, the only one who is responsible for this meeting. None of us would be here except for Commissioner Shaw, who came to the health department in the strangest of ways by way of primary care. Primary care internist at Bellevue, researcher in terms of the effectiveness of care, strategies that really work, and was appointed by Governor Cuomo many months ago to lead healthcare into this century, and has been an enormous friend, I know, to CBPH, Hudson Headwaters, and most of all to the people who live here who would do without if they didn't have this kind of support. Thank you.
Thank you, John, Betty, elected officials, mayors, staff, visitors, and guests. It's really an honor to be here today. When I was, I first met John about 20 years ago. Back when I was in medical school, his son, Bruin, went to school with me, and I was driving back from Yale to Buffalo. And I stopped on the thruway at one point and dropped off Bruin, and who knew 20 years ago that I would be standing here after spending the morning at Fletcher Allen with Stevens Monday and their crew, looking at how we're going to be integrating the systems of care in this state, and then ending up this afternoon in a beautiful setting such as this, a mile from the border, proclaiming the latest victory for primary care. So, you know, they say that failure is a red-headed stepchild, and success has many parents. Well, rightfully so. It does really take the community to come together to make something as incredible as this happen. Of course, a lot of the credit also goes to Dr. Racine, who has been providing care for nearly 25,000 people in this area, with hope and the promise that he could keep going and keep it together until Hudson Headwaters and others step in to help. And I think what you're going to see is that we are here at another frontier. This is a healthcare frontier. And frontiers are where the action is. This is where you want to be. This is where it's exciting. The healthcare frontier that we are at today is one for the future of primary care. How primary care will be delivered is going to be decided here for the whole country. Yes, there are dollars from Washington, assistance from Albany, and a lot of folks who will likely take credit for this. But the reality is it's the community that has come together in a way that only communities can, that has said that it wants a future with high-quality health care, and has reached across the borders, reached across the Hudson Headwaters and across the Vermont border, and who knows, maybe across the Canadian border, to create something that's really important. What we've created here today is a community of healthcare, and I like to call it an ecosystem of healthcare. This thing is now so strong because it has partners who want its success, who will see that it succeeds, who are now going to get the highest quality of care in the country, and you will continue to receive that care because of all the networks and the people who are invested in your success. You know, about a year and a half ago, when Governor Cuomo took office, he said, we can no longer do business as usual. Well, in Albany, it's easy for us to say, but it really takes your partnership to make it happen. And what I'm seeing here today, and what I've seen across the border in Vermont this morning, and at CBPH, and at all the frontiers of healthcare in New York State, is the future. This is the crystal ball of healthcare. What is healthcare going to look like in a few years? High quality, people who know their patients, patient-centered care, community-oriented, right here in your backyard. So on behalf of Governor Cuomo, congratulations for your success. I look forward to bringing the governor back at some point, and thank you.
So if you know of any physicians like move to the area, you let Dan Larson know. He's here, and Vicki, we're looking. and we're going to try to squeeze them in to this facility while we look for a new property and the funds, Dr. Shaw, for a new facility that would do us all proud and make this really a signature for the area. And with that, it's time for lunch. Thank you very much for everybody coming.
Joanne says, don't let Calvin corner you.
Don't let Calvin corner you. You got all kinds of room here, John, so if you can escape.
All right.
You're going to be on this Wednesday here. I'm rerunning the thing you and Bob did 2 years ago.
Oh, good.
At least an hour 50 of it. That's all the room I had left on the DVD. So.
Which one is it?
1992 is here.
Oh, yeah.
Bob started off by sitting in the waiting room, saying where, and Jack is the doctor. And
all that.
Yeah. You told me you didn't think you were going to be here when I saw you a couple of days ago.
Well, it's a long story that shortened. Made it back from Stowe and got the green light to come on board.
Well, glad you're here.
Yeah.
When I was talking to Dr. Ruggie and you showed up, I said, Dr. Southwick is the old guy out there.
The old guy.
So right away he knew which one I was talking about.
For sure.
But you weren't here at the very beginning, as people who will watch that show that Bob Venn and I did in 1992 will learn. It was Dr. Schulteis.
Richard Schulteis.
But you came shortly thereafter.
Yeah, 1963, right?
And you were here how long? How long did you...
Till 2004.
So that's something like 41 years, isn't it?
Pretty close, yes.
It's a long time. You figured you'd served your...
Well, I figured there was more time, but certain circumstances came about that suggested time to go.
So you've moved on, and it's going to be very gratifying to you, I would think, to know that this will carry on in a different form, but the medical service here in the North Country will continue.
I think so, and I hope so, and I gather they're looking for a new location, something more centralized. I suppose at the time that this didn't come out, I don't know if it came out, the reason that this was the site was because Sam and Esther Long were involved and said, here's the property, you can have it, build your office here, and we're glad to donate the property. So that was why the 3 communities, I mentioned the 3 communities, and the fact that I didn't say that there were members from each community, Ross's Point, Champlain, and Moores, and only one, Bob Mara, is left.
And some of those names are...
Well, between Bob Mara, Frank Forbes, Clifford LaPlante, Larry Paquette,
Jack
Zerlo, and from Moores was Amos Mousseau.
And Mel on there, Mel Ferns?
No, but
surprising.
Yeah, he wasn't. Frank Goodrich Jr. And of course the former principal of Moores too. That
Sugar. Vogan?
Paul Vogan.
Okay, and I know Jesse Walker from Champlain.
Jesse Walker.
I wasn't brave enough to, like you, to start naming them.
Yeah, I can keep going too. Okay. Ray Walsh from Ross's Point. You mentioned Jesse Walker, and Dick Collins. And who else? We got the 3 from Champlain. You got
is that plaque still in the board?
Yes, it is. Well, it was the last time I was there. Okay, so from Champlain you had Clifford LaPlante, Larry Paquette, Jack Zerlo, and who was the 4th one?
Jesse Walker.
Jesse Walker. Yeah.
Right. And if anybody has not been named, it wouldn't be them that would be hearing it, but their family members just
can come forth and say, like I did to you, about Peg Barcombe. But that's all right. Hey, you said you'd go talk to her. Well, someday we will be able to talk to her.
We'll both be chatting with Peg and with Bob Venn and a few other people.
Yeah. I got to put a plug in here.
Okay, put a plug in here.
Over the years, Calvin has produced more classic, historic videos for local people to hear and see, and it's been a great advantage, and I hope more people support his venture because it really has been a great thing that you've done for the whole community, Calvin.
Unfortunately, the folks who have supported me the most, not that I ever got a whole lot of support, but the ones who did the most were the older people, and
well, that's true.
A lot of them have moved on, and the people who grew up with hometown cable think that
if you if you go to the churches, what's left? The old gray-haired people like me. The young people, they're just not contributing. So,
yeah. So I wish more of the young people would understand that this is viewer-supported, and they just don't quite grasp that. But I appreciate your support over the years, and as I mentioned to you, I don't know if I've mentioned it on camera, this Wednesday as we're recording this, your show from 20 years ago, an hour and 50 minutes of it at least will be on.
Maybe more than should be, but that's all right.
But, you know, it really saddens me when I have to dig through those archives, because we just lost another person that Bob and I, or Gordy and I, have recorded, and we've lost in the past 12 months. Just last week I ran Paul Cloutier, and and you know, just like I'm not going to get into.
One of my former workers. See, I'm interrupting, and I apologize.
That's all right.
One of my former workers, when you came out with that show in '92, said, "I finally heard somebody that can talk more and longer than Bob Venn." That's you.
You're referring to you?
Yes. Yes.
But he hadn't seen the car show then.
No, he hadn't.
Because in the car show, you actually stole the mic.
Yes, I did.
The mic right out of Bob's hands. He learned from that, though.
Took the drop, and I also mic'd through the drop light too, right?
Yeah.
Okay.
You had the lead light there, and you were talking in that for a while. So you.
Yeah.
Yeah, but those were great times. Okay, well, we appreciate you finding time.
Right. Well, it's always been an interest for me to make sure go on. Here are your guys that you want to talk to over here too.
All right, thanks, John. Dr. John Southwick. Without his efforts, none of this would be happening right now, because he kept this place alive for 40 plus years. Okay, Stevens Monday. Oh, I'm going to hold it.
Okay.
CEO, is that what you're...
CEO of CVPH Medical Center.
Okay. Why is this important to the CVPH?
Well, you know, we're focused on improving the health of our community, and the best way to do that is through primary care at where people live. And this is such a great practice here with Dr. Racine and Dr. Southwick and others built here. And to try and figure out a way to solidify it into the future and to have it thrive and grow is a wonderful thing. So we're very happy about that.
So how much day-to-day will you be involved with what's happening here? More than what you would with what's happening already? Or?
You know, we do a lot with Hudson Headwaters, and we provide laboratory services wherever they have practices. So this is a really good thing. We'll be involved there. And then we'll sit down and have discussions. He was asking me just a minute ago about physical therapy, and I don't know whether we could do that or not, but we'll look at it and see if it makes good sense.
So you could be tying in some
yeah, we do. And then whenever their patients need to be admitted in our medical center, our hospitalist service, which are physicians who just do inpatient medicine, take care of them, get them well and ready to be discharged, and turn them back over to practice and coordinate and communicate.
It's never ending in your business, is it?
It is not. It's, you know, that's one of the unfortunate things. There's always demand for what we have, and as much as we try and do to make it less so, it's still always going to be there. So,
but CVPH is just constantly evolving. Every year, Gordy Little and I chat with you guys, and something new. It's just.
Well, I think as a community resident, that's what you expect of us, right?
Yes.
Right. So hopefully we're living up to that, and
so far
we work really hard at it, and it's nice to see it. Come to fruition, and there are times when we don't, and people let us know, and we take that equally seriously and really work on the ways that we can improve. So it's not always the good stuff. You know, we try and do all of it.
Yeah, well, your tenure there at CVPH has certainly been eventful, and you guys are never sitting on your laurels. You're out there.
I just give credit to the people who work at that organization, and every day I'm amazed at the humanity and humility of the people who work there and the caring nature they have, and it's a easy place to get up and go to work at it in the morning.
How long's it been?
10.5 years.
10.5 years.
Yeah.
It doesn't seem that long, but for us, but for you probably not.
Most days it doesn't. There's some that it does.
Some days feel like 10.5.
That's right. There are those, but you know, everybody has that, and this is a great place, and it's a great community, and you know, we just love being involved in the community. My wife and I, and the medical center is a phenomenal place to be associated with.
Well, I think the fact that CBPH is so much behind what's happening up here. It gives some assurance to the people who might be wondering what are we in for here, that this is going to be a first quality.
We work with this organization across the Adirondacks, and we're a partner with them. We are a co-owner of the Adirondack Health Institute, which is the overseeing group of the medical home. So we are corporate partners with them, and would just assure everyone that this is an outstanding move for this community. It will take a very good practice and give it stability into the future. Maybe give it a bigger base to grow from that it's been unable to do because of economics in the past. So I think it's a great thing. They're a class operation.
Glad to hear you say that, and I'm glad you guys are on board. Thank you, Stevens. All right. Stevens Monday, the CEO of Champlain Valley Physicians Hospital Medical Center in Plattsburgh. All right, he got his best suit on today, right?
Yep.
You know, you're starting to look a lot like a fellow who used to go around the machine shop at Sheridan, and there's a guy running a machine there. Looked a lot like you're starting to look here, young fella.
That would be my father.
His name was Morris Racine also.
Same receding hair. That's a tongue twister.
Dr. Morris Racine, 1981, you've been here?
That's correct, yep.
That's 31 years. You were just a youngster when this all began, so you probably weren't too aware of what was happening here back in 1959 and into the early 60s when it actually started, but I think the idea was conceived around 1959.
Yep. There was a group of gentlemen there. I think there were some ladies on that board too that had a good vision for the future, what was needed up here.
Yes, you know, and you're talking, two that stand out in my mind because they were plant managers of Franklin Forbes and Jack Zerlo, that, plant managers, they didn't just worry about running their operations, they worried about what was happening in the community, and it's just nice when folks like that feel that they are part of the community and take some leadership roles. Unfortunately that doesn't always happen, but it was great that they did. Now, graduate of Northeastern Clinton Central School, in fact the first graduating class of Northeastern Clinton Central School, as I recall.
That's correct, yep.
So that was 10 years before you came back here. Did you have it in mind when you were going to medical school that someday you'd want to? Yeah,
but the day I graduated from high school, I needed to get my life focus, and certainly has been since then. But
was your ambition then to come back here?
That's correct. With John, Dr. Salvik and Dr. Starr were my family doctors when I was a kid, and I had planned when I finished all my trainings to come back here.
I'm old enough that Dr. Van Acker was in the picture when I was a kid. Whatever happened here that did you suddenly hear about Hudson Headwaters?
I knew about them from going to medical meetings, etc. And I knew a little bit about Dr. Runge, and one day I gave him a call, described the situation up here, the need up here. Thought this was a great area for teaching, to get family practice, residents, students. The community is fantastic up here in terms of patient population, and we started talking over the years, and then all of a sudden we started meeting and then applied for the grant. We didn't get the grant the first year, and this year we got the grant, and now the ball's rolling.
Yeah, because I know, talking with Dr. Southwick earlier, it's important to him to see that this will carry on, and as you know, you've got 30 years under your belt, so you maybe not have 30 more years ahead of you, so you're probably on that.
Well, there's other things I'd like to do down the road. Yeah,
so to know that this will continue, I'm sure it's got to be grateful to you.
Well, I think I have to say that the staff of ladies I have here worked their hearts out, did a lot of unpaid time to make this happen. This could never have happened without their help, and I think they have a real commitment for healthcare in this area, and I think that's.
So I take it you didn't say, "Hey, we want to be part of that," and everybody just signed the paper and off you went. Right?
There was a lot of hard work.
A lot of hard work, and you start getting federal dollars and state dollars involved. It's you got to cross a lot of T's and dot a lot of I's.
Their hard work made the hospital take a look at it, made Hudson Headwaters. It's getting the attention of, Vermont.
How soon can somebody walk in here and expect to see something different than what
The staff is going to stay the same. I'm going to stay here. There's nothing's going to change. It's just who's overseeing the whole organization. They're hoping within 39 months, 40 months to have a new facility, larger facility, teaching facility built that'll have more services they can provide, such as probably x-rays, ultrasound, etc. And hopefully we can start attracting residents, medical students, and hopefully some of them will want to stay here.
Yeah, and I even see dentistry listed as some of their places. That's something that they're
they're going to want to attract too. Yes.
So this will be. I guess the one in Queensbury is kind of like what they're envisioning for.
That's correct. Yeah.
So
and I believe in
there.
I think Warrensburg is the one they have. That's it'll be more like Warrensburg.
Now, do you still have the satellite office in Ellenburg? Or?
No, I don't. We haven't had that in over 10 years.
Yeah, I'm behind the times. Nobody tells me anything. But you have patients, I assume, from there.
That's correct. We serve about a 25 miles, semi-arc circle.
Well, I imagine you get some from Alberg and
not too many. More just from Beekmantown to West Shazy to Ellenburg. We service that area.
So the northern tier.
Right.
And since that last entity in Shazy closed, and
it's made it much more difficult for patients.
It's that you guys or go to the ER, and a lot of people have been overloading the ER too. Huh? So yourself, will this be easier for you? I would think you'll no longer have to have the burden of.
The financial burden will be off my shoulders. They're going to be recruiting really hard for another physician, so that if I do, down the road in the next few years, I need another hip replacement, etc. I've been very fortunate with my health, but God forbid something happens, that there's somebody here to take the reins, keep the place going.
Yeah, I saw you limping when you came across there.
Many years of hockey, So.
Guys bumping into you, right?
Or me into them.
You got anything else?
No, I'm just want to say again, I can't say enough about my staff. That they're a fantastic bunch of ladies.
So how big a staff do we have here right now?
15, 16. So.
And that includes you, or?
Yeah.
Okay. So, and you're the only. You said lady, so you're the only guy?
I have one maintenance guy too.
One maintenance guy.
I turn for counseling sometimes.
So you're talking to a male ear. I can understand that. Okay.
I usually tell people I work for 15 ladies, so.
They tell you what to do and how often to do it. All right. Anything else, Morris? That I should
Nope. Thank you.
Anything that those other guys over there, Tom Halleck and the guy from Channel 3 and Jeff Myers, asked you that I should have asked you?
Nothing to add. Just the community's fortunate to have Hudson Headwaters here.
I think, if I can be so bold as to speak for the community, I think it's great that you made that move, and this is going to be happening. I look forward to seeing it progress in the next several years.
Thank you.
All right. Thanks, Morris.
See you.
Yep. Dr. Morris Racine, the physician here at the North Country Medical Center, just off Route 11 here in the town of Champlain. I'm going to take a moment and read the Hudson Headwaters Health Network sheet that they handed us here, the information sheet they handed out to the people in attendance. Our mission is to provide the best care and access to that care to everyone in our communities. Higher primary care for a rural, medically underserved area. Hudson Headwaters Health Network is a not-for-profit system of 14 community health centers providing primary care to residents of 3,700 square miles of the Adirondack, Lake George, Glens Falls area. And of course those numbers will be going up after this announcement here. Hudson Headwaters is the sole medical provider in much of this rural, medically underserved region. An area more than twice the size of Rhode Island, in the Glens Falls area, Hudson Headwaters is the only primary care safety net provider. About 60,000 people use Hudson Headwaters health centers each year, and about 80,000 different people every 3 years. In 2011, Hudson Headwaters received some 260,000, it's a 250,000 plus, patient visits. Hudson Headwaters accepts everyone regardless of ability to pay. Our outpatients are served in Hudson Headwaters local health centers and hospitals, nursing homes, workplaces, schools, and in their homes. And that was one of the things when we talked to Dr. Rouget, that he did say that in some circumstances, they do make house calls. Hudson Headwaters provides more than $3 million in charitable care and pharmacy discounts annually to low-income patients. Under the heading of board-certified physicians and top mid-level providers, they have 58 physicians board-certified in their individual specialties, 62 physician's assistants, nurse practitioners, and nurse midwives, and a total staff of 557. And again, that will be increasing a little bit as soon as we're integrated up here in Champlain. The services, under services, comprehensive primary care, selected specialty care, dentistry, mental health, ancillary services including laboratory, imaging, x-ray, mammography, ultrasound, and bone density scanning, and health education. Enabling services include social work, case management, and facilitated insurance enrollment, sliding fee program, and discount pharmacy program for low-income patients. Under the heading of commitment and innovation, a true safety net commitment, Hudson Headwaters doors are open to all. Extensive use of physicians, assistants, and nurse practitioners. Extended office hours, including evenings, weekends, and holidays. Introduction of specialty care to our rural communities. Expanded staffing for the summer tourist season. Home-based case management initiatives. National demonstration project for discounted pharmaceutical services for uninsured patients. And a federally qualified health center. Under healthcare rooted in the community, it says in most of our Adirondack service area, the local towns provide the facility, utilities, and upkeep. In return, Hudson Headwaters provides assured medical care. That will not be the case here as far as the town providing the facility. They will be looking for their own facility and be looking to use some state or federal money to help make that happen. Each town served by Hudson Headwaters is represented on our board of directors. The board is a talented group of community leaders who provide oversight and guidance for the entire system. And as was announced here, Dr. Celine Paquette will be the representative from this area, and certainly we'd be hard put to come up with a better representative. The operation of each health center also receives guidance from an advisory committee composed of the town supervisor, local residents, and members of the Hudson Headwaters Board of Directors. They have a website if you'd like to visit that website and learn more. It's www.hhhn.org. So HHHN, which is Hudson Headwaters Health Network.org. So www.hhhn.org if you want to look on the internet and come up with more information about this group that's coming here to the Northern Tier. So congratulations to everybody involved, and a lot of work went into making all this happen, and a lot of work will be happening in the future. Thanks for watching viewer-supported local television, hometown cable.